Hello, this is Dr. Marshall Ross. I am the Chief Scientific Officer of the Newly Institute, and I'm here for our next episode of the Medical Optimization course. Today, we're going to talk about social connectedness, how to thrive with your tribe. We know the COVID-19 pandemic has led to a second pandemic, a shadow pandemic, a mental health pandemic. Mandated social isolation has led to unprecedented rates of depression, anxiety, and addiction. The hospitals are full, and not just with COVID patients, but with people with mental health issues, particularly children's hospitals. We know that socializing with your family and your friends has been proven, scientifically proven in study after study, to reduce anxiety, improve coping skills, increase your quality of life, improve your psychological and physical well-being, actually increase your lifespan. You live longer if you're a social person. It lowers level of distress and lowers rates of depression. That's powerful. I love this quote. You're the average of the 5 people you spend the most time with. So choose carefully. The people you spend time with will impact who you are and direct the course of your life. Take a minute to reflect on that. What I want you to take home is that you should put time and energy into maintaining the right relationships. You should also recognize when to take space and move away from relationships that aren't making you into the person that you want to be. So let's do a quick exercise. If you have a pen and paper, please pull it out. Think of 2 people in your life, people you spend a substantial amount of time with, ideally in the top 5. Think to yourself. So right now, if you have paper and pen, write down the name. You can get rid of this paper later. I want you to think to yourself, is this person negative or positive? Do I want to live my life in a similar way as this person? How do I feel after I spend time with them? Are we able to have meaningful conversations? Do we have fun together? Is this someone that I admire? So what I want you to do is hit the pause button, take 5 or 10 minutes, choose 2 people in your life, and go through these questions. Write down the answers. Take a moment to reflect on how these people impact your well-being, your mental health. So go ahead, hit pause now. I'll see you back in a few minutes. All right, welcome back. Hopefully that was a interesting exercise for you. So here are some things that you can do to improve your social connectedness right now, to manage your relationships, and help this be a productive part of your life that adds to your life and doesn't take away from it. Establish your support network. A support network is a powerful tool. If you're comfortable doing so, you can involve your support network in your treatment program here at the Newly Institute. You can tell them about your experiences, what you've been going through, and allow them to support you. Bring in your family and close friends. In doing so, will help you get better faster and stay healthy in the long run. Establish your support network and use it. Be wary of flooding. Try not to flood your family and friends with all your progress. You're going to have days where you have taken huge steps forward, where you've learned a lot about yourself. You've made breakthroughs. And the tendency is to want to get on the phone or talk to your significant other and tell them absolutely everything. But sometimes it's too much. Instead, it can be good to provide updates, communicate with your support network without overwhelming them, without flooding them. So just be wary that this is something that often happens as people go through treatment. Be aware of it. You may or may not do it. Boundary setting. What is a personal boundary? A boundary is a guideline that outlines how others are allowed to behave around you. You need to recognize what you're comfortable with in each relationship and day-to-day experience. You need to trust how you feel and be assertive in communicating where your boundaries lie. As an example, you may be interacting with someone and feeling uncomfortable. You may have a hard time putting your finger on it, but something that's happening is making you uncomfortable. You feel uneasy all over, and you're maybe not quite sure why. If you find yourself in that situation, there's a very good chance that one of your personal boundaries has just been violated. Maintaining our boundaries can help prevent feelings of resentment and frustration. Although it can be hard to set boundaries, particularly when you're learning, they can actually improve and maintain healthy relationships. So while setting a boundary feels like you're pushing someone away, it may feel like you're offending them, it'll actually help you be happier. It'll actually help build your relationship with someone. The best relationships have very clear boundaries. We know setting healthy boundaries leads to better relationships, leads to decreased anger and resentment, an increased level of compassion for others. It's much easier to feel compassionate if someone's not walking all over you, so to speak. As you go through your treatment program here at the Newly, you're going to connect with others. Setting effective boundaries will set you up for successful social interactions and long-term relationships. Consider your treatment an opportunity to practice the skill of setting healthy boundaries. As you meet people, as you interact, recognize what makes you uncomfortable, recognize what you're comfortable with, and be clear. You can even use the term boundary. That's a personal boundary for me. There's nothing wrong with saying that. We all speak the same language. So as you meet people, as you establish new relationships, use this as an opportunity to become better at this difficult skill. So here's a few examples. Let's say someone comes up to you and they want to give you a hug, but you don't want to hug them back. Think to yourself, what might you do? What might you say? If what you thought to yourself was, I would probably just hug them, that's the wrong answer. If you're not comfortable with that, you owe it to yourself and to the person who's, wanting to give you a hug, that you're not comfortable with that. You owe it to yourself to set that boundary. Let's look at a few examples of how to set boundaries, a few lines you might use. Think of these as tools in your tool belt. Think of these as lines you might pull out when you need to set a boundary and you're not quite sure how. So someone wants to give you a hug. I'm not really a hugger. I'm more of a handshake person. Let's say somebody is pushing you to speak about a topic that you don't want to talk about. I'm not comfortable talking with you about that. It's a simple sentence, but it's powerful. It's to the point. It clearly sets a boundary. Let's say someone at work is pressuring you to do something on the weekend. I can't come to that event this weekend. I will be with my family. Nothing wrong with that. Here's another line. I'm happy to speak with you more about this later, but this is not the right time or place. I've used that one many times to get out of conversations that I wasn't comfortable having in that time and place. I will not be giving you money. I'm happy to help in another way. That's fair. It establishes a boundary, a line that you won't cross, and also shows that you're happy to help. You're a kind person. You're just not willing to cross this boundary. I'm here to work on myself. I'm not looking to make any new friendships at this time. There's nothing wrong with that. If you're going through treatment and that's the way you feel, if that's your personal boundary, please set it. The last thing I want to point out is that while you go through treatment, you will be changing. Your brains will be getting rewired. You'll be thinking about things in new ways. You'll be having epiphanies. From Monday to Tuesday, you may dramatically change your opinion about certain parts of your life. What we ask is that while you're going through treatment, don't make any major relationship changes. Don't fire your friends. Don't, divorce your significant other. Wait until you're done the program. Wait until you've had time for these learnings to set in. Wait until you've become comfortable with the new you. And at that time, if you need to make changes, then I encourage you to do so. But just hold off. You're here to work on yourself. So get yourself to a place where you need to be, and then make changes in your relationships afterwards. It's all about timing. Here is your social connectedness prescription. Think of one social activity that you would enjoy, and think of one positive social connection that you have lost that you would like to rekindle. So I'd like you to do this now. Take a pen and paper, or you can do this in your head. You may, and I want you to think of a social activity. This may be volunteering. It may be doing stuff with your kids where you might meet other parents. This might be a meetup group, a sports activity, choir, art class, you name it. Think of one social activity that you would enjoy. And then your next task is to think of one positive social connection you have lost that you'd like to rekindle. Maybe it's an old friend. Maybe it's an old family member. Maybe it's a connection to an old sports team or group that you've lost. Maybe as part of your journey through mental health, you've struggled to maintain those connections. Think of one connection you'd like to rekindle. So please press pause and take a minute now to complete this 5-minute activity. Go ahead. All right, thanks, guys. Appreciate you joining me today, and I look forward to seeing you on the next piece of our medical optimization course.